Hi and welcome. Today we're looking at how can psychedelics help in treating addiction. Addiction is a complex condition that has the ability to ruin many lives. For something that is so complex and damaging, modern treatments aren't as effective as we need them to be. Many modern therapies involve treating addictions with drugs, however counterintuitive that may seem. To name a few, methadone is usually used to treat opiate addiction and nicotine for tobacco addiction. These treatments can be physiologically dangerous as they can cause a physical dependency and a variety of unwanted side effects. However, not all drug therapies are bad. For a long time, researchers have identified the efficacy of treating many addictions with psychedelics. Psychedelics have been shown to be physiologically safe and have little risk of psychological harm. Research on using psychedelics for addiction has been around since the 1950s, showing great promise but took a long hiatus due to the fallout from the war on drugs. Despite the political forces at play, research in this area has started up again in the last decade. Research in this field has focused on the classic psychedelics, including LSD, psilocybin, mescaline, and DMT. The classic psychedelics all have one thing in common, and that is their effect on the brain's serotonin system. Thanks to these effects, studies have consistently shown that patients with addictions that are treated with classic psychedelics have better outcomes than their controls. So, how exactly do psychedelics help treat addiction? It has been hypothesized that psychedelics help treat addiction through complex interactions between the physiological and psychological effects of psychedelic use. Researchers have proposed 4 ways that the change in serotonin can affect those with addictions physiologically. Firstly, it's hypothesized that psychedelics enhance serotonin, which could be depleted due to chronic drug use. Secondly, that serotonin is able to act as a neuromodulator to other neurotransmitters that may not be working as they should. Thirdly, the psychedelic's effect on the serotonin system can reduce cravings and therefore reduce the risk of relapse. And lastly, psychedelics are able to reset and rewire the brain back into a pre-addiction state. In addition to the physiological changes, researchers have identified many positive psychological effects of using psychedelics. After psychedelic use, patients usually have an increased self-efficacy and the belief they can get better. They have positive changes in personality, including increased optimism and interpersonal confidence, and have positive changes in mood and affect. Self-efficacy, personality, and mood all work together to increase a crucial part of rehabilitation: motivation. The motivation to get better through an interaction of these effects can help the patient overcome their addiction. It seems as though researchers identified a relatively safe and effective treatment for addiction. Through complex physiological and psychological interactions, psychedelics have consistently yielded better outcomes for people struggling with addiction. Given the many decades worth of evidence, we must now ask ourselves why the psychedelic treatment of addiction is still prohibited.